because I had been in the Army and I had been mostly in California, Georgia, and North Carolina, I got exposed to things that I didn't get exposed to here. I did see what the degrees of separation were, and hear many of the rationale that people gave on why particularly blacks and whites shouldn't mix, shouldn't be in the same neighborhood, same school, drink the same fountain and all that. I heard that. And it really turned me off because the way I grew up, my dad always said that even though we were poor, that no one, regardless of who they were, was better than us, or we weren't better than them. We were all pretty much the same. And I could really reflect on that because most of the people that I was around growing up in the projects were blacks and whites for the most part. And as I found out later, I mean, I didn't even know why we lived in the projects, because actually it was kind of nice, because we had heat and running water, and it was just a place to be. It was kept up well. They had a crew that came along and mowed the lawns, and the streets were well paved, and they had laundry rooms where you could go do your laundry and all that. So it wasn't all that bad. People had cars. Some people had cars. A lot of people took the bus. So for me, it wasn't an evil, nasty, negative place to be. Only later on did I find out that those kind of conditions were looked upon differently by different folks. But what I did see was a lot of opportunity that particularly black people didn't have. I remember that as I was growing up, the public health hospital that we now call Harborview was not a very pleasant place to end up, partly because of the negligence that people felt when they went there, the disrespect that they felt they went there when they had to wait for hours to be seen. This is a place that even though people didn't have money, I felt, as it turned out, they were very degraded as human beings to get that kind of care that they either were or were not getting. And so when I joined the party, that came up again because it was told to us that we not only did we have to be somewhat defensive about our posture to defend the right of black people to be whole human beings, we had to figure out a program or a project that would, in a way capture the imagination of the people. And so this whole notion came up that, well, maybe we should figure out if anybody else in the community is interested in us helping, for one, helping provide black people some accessible medical care. So I remember one very interesting meeting when we went out to the University of Washington and talked to the professor who was the chairperson of the School of Social Work, and then we talked to a Superior Court judge, Judge Smith, and some other folks who represented the black bourgeoisie in Seattle. And they were very interested in what we were saying because they said, well, this has never been done before, but there's certainly a rationale to do it. What you got to do is find, we don't know we've never done it before, so it's not like they had any advice like that. But they said you got to find people who are going to support you. You got to find. You don't want to double black people's anxiety by asking them to come to something when there's nothing there for them. So you got to go out and find resources. And so we felt that if we could find some doctors and some nurses and some other medical related people to help us start what we consider to be a free medical clinic that people had access to, that would be a good thing. And so kind of that's what we did. We kind of instituted 2 or 3 different clinics in 2 or 3 different places in the central area now, because that was the focus of most of our work. And that was really exciting to me because to see people come through who really needed that was an indication that we were doing the right thing.